Hey everybody, it's Sean Gibbons from the Communications Network. Hope you're doing well on this summer Thursday. Chances are you're in a part of the country that is beastly hot, so I hope you have an opportunity to get cool or get near some water before too long. But for the next hour, you're in for a treat. We're going to have our friends from Rockefeller and Hattaway talking about all that they've been learning over the course of the pandemic and how that's really reshaped the way Rockefeller thinks about communications, both integrating it across its teams and also really being smart about how they're messaging, not necessarily being driven by what you're seeing in the media, but what people on the ground are actually thinking. So data-driven comms, which is obviously the way we all need to be doing our work. I'm going to yak at you for a quick minute just because we're filling up the room. And as I do so, I'd invite you to join me. If you go down and take your cursor, go down into the chat. That's that little word bubble. Click that open if you would. And if you would, make sure you're talking to all panelists and attendees, or it might say everyone. And if you would, make sure you're talking to everyone. But go ahead and just type in your name, where you're coming in from, and then this idea that we continue to borrow from Professor Brene Brown down at the University of Houston. And that's that two-word check-in. In 2 words, how are you doing right now? Hope you're doing well, but I get it. We're in the midst of a lot of stuff going on right now, gang. So maybe doing well is not the answer, but I'll meet you in here right now. Hey, it's Sean in the Catskills. I'm about 90 miles outside of New York, and I am hot and happy and tired. I'm going to do 3, tired of the pandemic. Jade, how are you? Excited and thankful. Suzanne in Santa Cruz. So 2 sides of the country, hungry and curious. Well, Suzanne, I'm thinking lunchtime's happening for you before too long. Michelle up in Oregon, motivated and busy. Hey, Kate, my friend over in Baltimore, feeling well and swampy is the definition of what's happening in the DC, Maryland area of Los Angeles. Angela, Kareem, Catherine, Dan, Jesse, Ross, how are you? Annette, Andrea. All right, starting to go a little too fast for me, but chances are you see a couple familiar names in there. Feel free to reach out because through the chat you can talk to folks individually if you'd like. So welcome to do that. As we always do across the course of this hour, if we're sharing links, we'll put them here into the chat. So look for them there. And then one other little piece of housekeeping, we'll take questions across the way. So you can start putting them in now if you came with one. But if you would, go ahead and put it in that Q&A box, which at least for me is over in the far right-hand corner. If you hover with your cursor, you'll see it there. That's where we'll be looking. And even if you don't have a question, take a look at what other folks are asking because you can vote for links. So if there's or vote for questions, rather, you can vote up the questions. So we'll try to take the ones that are most relevant to the most folks. Hey, let's see, who else do we have? Sue and Cindy and Helen and Annette. Glad to have you all with us. My partner in crime, Tristan Mahabir, is running the deck here. Mr. T, if you would, take us forward. I have a couple quick things I want to tell you all about. Chances are you know this by now, but we will be gathering again as a field in October, which I think is now 54 days away, October 6th through the 8th. We've got a really amazing lineup. One thing I think I can say without Carrie killing me is we just learned that Dr. Carmen Rojas, who's just amazing, she's the new CEO and she's just a force at the Marguerite Casey Foundation. She's going to lead a conversation with one of our keynotes, John Powell, who leads the Othering and Belonging Institute out at the University of California, Berkeley. Thrilled to have their help. We'll also have a case study keynote from a Jones Award winner, which we just determined through the judges, and we'll be announcing that next week. So I got to keep that behind the curtains for now, but suffice to say, excellent stuff. And here's the thing you really need to know: that deadline you see down there, you got to register by September the 8th. We've already a little over 60% of our seats are spoken for, so we have a firm number that we can accommodate this year. And so if you don't get in, I'm afraid we're going to have to ask you to wait until next year, but we'd love to have you with us. So September the 8th, you can get all the information and register right now at comnetworkv21.org. See it all there. Mr. T, if you would, take us forward. Again, this is something else I think a lot of you know. The network doesn't just happen to gather when we gather at ComNet, or in this case, V this year. We also try to make an effort to get together lots of times during the course of the year and really focus on building community where you're living and working. For a lot of us, that looks a little bit different. And for now, for us, that's been virtual, but we have 16 local groups around the country. And so you can see that link that Kareem just put in there. Click there, and chances are you're going to find a city near you, and you're welcome to join up with those folks. And coming up in just the next couple of days, our friends from San Francisco and Los Angeles are actually collaborating to have a happy hour. So if you'd like to join them for a couple libations, I'm sure they'd be happy to see you. And George, you should be one of them to potentially get on from leading ComNetwork Boston. We're happy to have you here. Mr. T, if you take it forward. And there we go. That's that happy hour I just mentioned. It's actually today, East Coast time. So for those folks who are looking for a little something to do a little bit later today, 4 to 5 Pacific time. So that's dinner hour, I guess, here on the East Coast. But feel free to dial in and join everybody. That's going to be happening on Zoom. Mr. T, if you would, take us forward. Other thing I want to just mention super briefly, it's kind of self-explanatory. We started a listserv last year in the middle of the pandemic, thinking Lots of us have questions. Inevitably, somebody else out there in the world has an answer. It's free and available, whether you're a network member or not. We're really proud of that. And so encourage you to check that out. They're threaded conversations. You can always search and see if someone else has asked something you've been looking for recently, or you can just dial in and ask a question. There's always an answer on the other side. It's pretty remarkable. Mr. T, if you would, take us forward. And then last little piece I want to tell you is we will have transcripts. So if you see down in the lower hand here, you can see the CC for closed caption. You should be able to see that. But beyond that, our friend Kenya is joining us, and she'll be offering, as she's done many, many times, and we're grateful to her, ASL interpretation. So if you want that, she's going to be popping up in the screen in just a quick minute, and you should be able to see the transcripts now. There, it should say live transcript has been enabled. All right, so with that, I think I'm going to pause, and I believe I'm passing to Estelle, our good friend from Rockefeller. So why don't I get out of your way, and you'll see me again on the other side and a couple times here for questions. But Estelle, if you would, take it away.
Awesome. Thank you so much. Really lovely to be here with my Hattaway colleagues. We are here to talk to you about a couple things, but first, before we get started, I just want to introduce ourselves. My name is Estelle Willie. I work at the Rockefeller Foundation on the communications policy and advocacy team, and really using these important strategic communications levers to really amplify the work that the Rockefeller Foundation is doing on our U.S. COVID-19 response. Carrie?
And I'm Carrie Shum. I'm the lead on the Rockefeller work here at Hattaway, particularly overseeing the research and the message testing that we've been doing for them over the past year. Oh, you're muted, Carlos.
Sorry about that. My name is Carlos Diaz. I'm director in the strategy team over at Hattaway Communications, and have been working with Estelle and Carrie on this work. And you might have seen me host some webinars on our own for our staff community, which we will share some lessons about those in this presentation.
Perfect. So there's three big things that we want to cover today. If you want to just go to the next slide. Perfect. So first, we want to give you guys an overview of how we're using communications and partnership building to really amplify the impact and the work that we're doing at the Rockefeller Foundation. But then I want to do a deep dive. Carrie and Carlos will be giving a deep dive on two critical elements that really made our approach hyper relevant to the key audiences that we were trying to reach. And this was both using research to inform our messaging, and also building a community of practice where we are able to listen to what the issues and the unmet needs that they were having, so that we can really deliver more relevant products, tools, and whatnot to the community. So next slide, perfect. So we have been working for like the past, I don't even know, I want to say my entire life now on the COVID-19 response here in the United States. And really from the very beginning in March 2020, given that Rockefeller has played a huge role in building the field of public health and just working within it, we really wanted to use the network that we already had and the grantees to figure out how we could best support what was happening on the ground in the US. And what was interesting is that Rockefeller, in like the past 2 decades, has really been an international organization. We've been working in other regions of the world, but really what we were seeing in March 2020 was that, you know, there was a huge unmet need in the United States. And so we really went deep and worked across sectors to really fulfill some of these needs that we were seeing on the ground, the immediate needs. So the 4 things that really unified this approach was building a network. That was super important for us because we wanted to understand what the issues were so that we could develop something that really was relevant to everyone. The second thing was really balancing the opportunities while also staying true to our mission. And I'll talk about that in more detail as we go on. But this was something that I think everyone struggles with, and especially during a pandemic when things are evolving constantly. How to do that and how to balance that was really important. And then 3, I've talked about this a lot already, but creating that culture of learning and collaboration, both internally within program teams and the communication policy and advocacy team. How do we do that? How do we learn from each other? But then also how we do that externally. And then the 4th is really, using all of these influence levers. And I use the term influence because communications people often think about, no offense, communications network, but some people just think about it as strictly PR. But there's so many different levers that we can use to create that collective impact model through partnerships, through coalition building, through communications, through advocacy to really drive an outsized impact. So let's get into it. So at the beginning of this pandemic, it seemed like their program teams were running in all sorts of different directions. And what I've learned and what you all are work on as well is the impact narrative, and using a narrative could actually help both from a communications policy and advocacy standpoint, but it actually also helped the program team really organize their program in a way to help them understand how different pieces of their work would drive towards, their North Star goals. So what I did was I tried to integrate myself into the program team and really embed myself into every single phone call, conversation, learn about all of the different grantees, where we're investing our money, and really going far beyond what typically you would do for communications, so that I could understand the whole ecosystem of the work that the foundation was doing to really figure out how all of the pieces are put together. And once I then figured that out, then I was able to create a narrative and bring together all of these pieces to really drive outsized impact. So we'll go through these 5 pieces, but really quickly, the formula, I guess, if we want to talk about it in that way, is really, the expert input and then testing ideas, because, philanthropy, that's what we can do. We can test hypotheses, galvanize different cross-sector partners to come together, being opportunistic with what we're doing, listening and delivering, and then building up those relationships for outsized impact. So at the very beginning, we'll go to the next slide. So we started out from the very beginning thinking through what is an immediate thing that Rockefeller could do to help with this crisis. And because we didn't have vaccines, testing seemed to be something that not many people were focused on, but could actually help with a data-driven response. But what does that look like and how can we do it? That was something that a lot of people were admiring the problem, but we weren't actually able to, we didn't actually quite know the solutions. So what we did was we worked with Duke Margolis, Center for Health Policy, to put together evidence-based testing protocols. At the same time, the foundation was also working on figuring out how to test interventions in schools. So testing pilots going on in K through 12 schools. And for me, I was like, okay, all of these things are happening all at once. And also our STAT community was talking about, oh, how are we going to get back to school and all this stuff. So what I did was we launched a program rather than just launching different things at different times that put together the testing protocols with the pilots, because we were testing the testing protocols within these 335 schools, and then brought together the school communities that we're going to be working with and telling their stories about what this program could do and the potential impact of it. So we started off focused on the K through 12 work. And then what we did was we took that piece and we worked with partners to figure out how could we, learning from the work that we were doing in schools, create the resources to expand this and scale this. So the second, if we go to the next one, so what we did was we used our thought leadership and brought together 150 experts within the education, the public health space, and also the testing and diagnostic space to think through what could it look like if we actually could bring testing to schools all over the country. And that turned into our Taking Back Control report. And it brought together the testing capacity, what that could look like, cost estimates for the federal government and what that could look like. And it was signed by a whole coalition cross-sector from education, public health, and also the diagnostic space. So we launched that in December. And what that did was kickstart a conversation that the incoming administration was having about reopening schools. And so with that report, we paired it with an op-ed where our president, Dr. Shah, worked on an op-ed with the AFT, American Federation of Teachers President Randy Weingarten, on an op-ed about the importance of testing that we purposely wanted to place in a news outlet like USA Today to reach a wide audience. So those are the two things. And that was happening, remember, during the incoming administration. So then that leads me to the third piece about being opportunistic. So as you know, we launched that pilot with the 335 schools in October, and that was going to be a year-long pilot. But the conversations that policymakers were having were in January, February. So we decided that instead of waiting until the very, very end to get the results and publish it, we decided to actually publish preliminary results on what we were seeing within the pilots, and also working with Rand Corporation, do more of a landscape of what was going on across the country to see who was actually able to do these testing programs and what did it look like from an equity perspective for a school that wasn't necessarily a private school, didn't have all the resources, were they able to do this type of thing? So we actually paired both of these reports together and launched it. And when we made that announcement, 2 weeks later, we got a call from the White House, which was super exciting, who was really interested in this data because it was the first of its kind about using testing to reopen schools. And that actually helped lead the way from when the America Rescue Plan was signed into law for a $10 billion allocation for testing in schools that we're now partnering with the CDC on. So that was a huge outsized impact and really exciting. And then the fourth thing is we also wanted to listen and deliver on what people still felt like they needed help with. So, you know, those two reports that we put out in January, February timeframe, I'm forgetting the exact date, but we put that out at the beginning of 2021. And a lot of the insights there were about education leaders just didn't have the public health expertise to be implementing these testing programs. We also heard that parents were just really, really concerned about bringing their kids back into school. There wasn't that much, community buy-in was very low. So how do we help with these issues? So we launched a playbook for school leaders on how to implement testing and really how to partner with academic institutions, public health schools who are very eager to help with this. And we put out a playbook that was actually now is cited by the CDC as one of 4 resources that school leaders can use. when they're thinking about implementing a testing program using the federal dollars. And then we also worked with Rand Corporation on a survey, and we're actually putting out the results of the second wave of this survey next Wednesday. So look out for that. But really thinking through parents' attitudes and preferences for bringing their kids back to school. And what we found in the first wave, and this was before the Delta variant happened. So, things may or may not change. I'm just gonna continue with that teaser. But really just everyone wants their kids back into school because it's not only an issue for, the kids and the amount of toll that they're facing, both from an academic perspective and then also from a social perspective. But also it's an employment issue. So they're desperate about bringing their kids back to school, but there are some serious considerations about what schools are doing to make it safe. So that was what we were hearing from that survey. And then the fifth one is really building the relationships for outsized impact. And I accidentally just, completely buried completely went off. I talked about in the Be Opportunistic piece, but really how we were able to bring together the different diagnostic testing companies, the government sector, the public health sector, and then also the education sector to come together to develop solutions. Those relationships really do, if you build them and build that coalition, it really can drive outsized impact. So of course, it's $10 billion testing plan for COVID-19 that the Biden administration unveiled, but then also we brought together, the 21 diagnostic companies to help build that bridge between, okay, we have the federal funding, now how do we get the tests and who do we partner with? And that's something that actually Barclays put out an analyst report just talking about how this framework that we developed with those testing companies, how impactful it was going to be for schools. So those are the 5 pieces of the strategy. And I'm sure you guys all have some questions. So if you guys want to go to the Q&A piece here, but really quickly before we get to that piece, I wanted to show you all this decision tree that really helped me think through during like a time when there's opportunities that we could do versus what is strategic. This is kind of how I thought about the decision. And I thought maybe I would just share it with you all here in case you're also wrestling with these issues as well. So really quickly, does it align with programmatic strategy? Does it reach the key audience that we're hoping to target and reach? And then also, does it fit with our existing budget and resource planning? So there you have it. All right, I'll turn it over to Sean, who I think is going to do the Q&A.
I am, and gang, if you would, go ahead down to the bottom of your screen. A question just popped in, and while I get ready to read that from Angela, Estelle, where did this, it's a beautiful system. I know Rockefeller spent a lot of time thinking about an influence strategy, about how they work, or how y'all work. Where did you run into some obstacles? What were the bumps in the road?
Really good question. I think a lot of the bumps in the road happen to be bumps in the road because of the evolving pandemic. It's like you plan and you plan and you plan, and then the next day a variant shows up and everything has to change. And I think that was the hardest thing. The second piece is communications is often like the ugly stepchild of a public health response. I think a lot of the technical people don't really think about the value of communications until it's almost too late. But really, outbreaks start and stop at a community level. And you have to get someone to understand the value and importance of taking a protective action during an outbreak. And it's so critical. So to me, communications is so intrinsically linked to the success of an outbreak investigation. And, I've been working in this field for a very long time. And one of my first jobs was as a consultant for the CDC doing outbreak investigations. So I have this experience, but a lot of people don't really think about it until it's too late. So it is interesting, when we first were giving the grants to the schools to do these pilots, there was no line item for communications. And it actually took quite a long time, and listening and seeing what was happening in the first 2 or 3 months of the pilot for the team to finally realize. And I think in that time, I was building trust with this new team, and they finally were like, oh, we get it now. And Hattaway was actually a really critical partner with me on this, because as Carrie will talk about, we used a research to help, justify that decision as well. So I guess those are the two big ones.
2 questions. Let's see if we can move through them quickly, because I want to be mindful of time, because we still have quite a ways to go through the presentation. Angela asks, how did you build relationships with folks who were anti-science or highly politicized folks that may be working in state legislatures or in a governor's office? Was that a challenge? And if so, how did you work around it?
Yeah, I think from my perspective, the people that we worked with in each state, they are part of the COVID-19 response teams. And while they were appointed for political positions, at the end of the day, every single one of those people want to do right for their constituents. So the people that we were working with, while they might have bosses who, were on the media using, talking about things in ways that might not be the most constructive, the people we were working with on a day-to-day level, it was a very different type of relationship. And I think bringing the group together once a week, and listen, they meet 3 times a week to talk. And it's a safe space that we created. It's not recorded. We don't have reporters join, nothing like that. They're able to learn from each other, hear what other people are doing, troubleshoot, and we're listening along the way. And then, delivering things that would help them. So, for example, there was an issue with a very technical CLIA waiver. It's the way that you were able to implement testing in schools. And each school had to do it themselves. So Texas was able to actually do a blanket CLIA waiver for the entire state for schools to implement testing. And actually, so many states were able to learn from that experience and able to do it in their state too. So it's, it's interesting. Carrie's going to talk about this too with the research, what you're hearing online and what you hear in the media might not actually be reality. So it's just something to think about and remember.
Let's take one more from our friend Alice, and then Cindy, we'll get to yours a little bit later, if that's okay. How diverse was the geography of your pilots? Were you looking at small communities versus large? Can you just sort of describe for folks what that coalition, that network looked like?
Yeah, it was actually pretty diverse. We did that on purpose. So, we had the state of Rhode Island and we had DC, but we also had Tulsa. And of course, I'm blanking on all of the other ones. But, we had rural, we had urban, and we had suburban. And then we also had the entire state of Rhode Island. So it was definitely diverse in that way. We also had diversity in the types of schools. So we had charter schools, we had public schools, and I will put into the chat the report so you all can see it, because there's this really great piece in there about communications and what we learned from the year-long pilot. So definitely put that in after my section.
Thank you. Okay, gang, I'm sure you have more questions. You're welcome to put them in there. We will have a couple more breaks for questions along the way, but now I think we're going to pass to, I believe, Carrie, right?
Yep.
Okay, Carrie, if you want, take it away.
Yeah, as Estelle said, I can't believe this is a year ago, but this is, if you cast your mind back to a year ago, these are the kind of things you were seeing in the media. This was the sense of how America felt about the things they were being asked to do, that people didn't want to be told to wear masks. They didn't want to be told what to do in any way, shape, or form about staying home or closing their businesses. Of course, the infamous party in the Ozarks over 4th of July with all the people packed together. And so when we started working with Rockefeller last August, this was sort of the conventional wisdom about what we were up against. But as anyone who works in communications research knows, the first thing is know your audience. And I think the big challenge was, for truly the first time in my career, my audience actually was the general public. So anyone who worked, your segmentation, and say the first question you ask is, who's your audience? And you start to sort and sift of who you really need to target. We had to talk to everybody. This was equally, at this point, everybody had to know everything about everything, which is a challenge. But that's the beauty of research, is that you can figure it out. And you start by asking the right questions. And as Estelle mentioned, our network here was incredibly useful. So we were talking to public health people. They were telling us what they wanted to know and also what they were being asked. We were talking to the political side, the governor's offices, what they needed to know, what they were being asked. And obviously lots of people were doing lots of research. So we dug into all that to develop our questionnaire. We did two things. One was we've done a tracking questionnaire for four different waves. We're about to write our 5th wave. So if you have ideas for questions you would like to know the answers to, please put those in the chat and we will do our best to fit them into our instrument, which we're working on right now. And then we double checked it, or got the sort of texture around it, with focus groups. So we did online groups last fall when we were working on the back to school stuff with parents and frontline workers. And then we did them with healthcare workers, teachers, and Black and Latino frontline workers on vaccines in March, to get those sort of balancing our quant and our qual with each other. And one thing that was incredibly useful and heartening to me as an American wrestling with this myself, is most people are doing the right thing most of the time. And so that is a huge contrast to what we're being told. And it also helped us get the right messaging out. Because if you think everyone is opposed to something, you look at what you say about it very differently than if most of them are already doing it, but you just need them to keep doing it. And very particularly, the way we phrased this question was really important. It was about willingness to do it. So this was not surveillance. This was not, we've guaranteed. This was not self-report. This is, where's your mind? Where's your attitude? What are you thinking about these things? And you'll see the variation. The things that are simpler and more personal, more people were saying they were willing to do them. So washing your hands, wearing a mask. The things that were more complicated or further away, like contact tracing, less people did that. Very importantly, this data was very consistent across all kinds of breakdowns. The numbers weren't the same, but the trend was the same. So there might be slightly less agreement overall among the Black community, but it was still very high, and it was still higher for washing hands and lower for contact tracing. So we didn't pull it out here, but what that said to us is we could have consistent messaging and reach lots of people with it, which is another really important thing. So to keep going, I hear you're all anxious. Oh, this is our favorite slide ever. So we were all at home, sitting on our floors, doing focus groups. These were focus groups with Republican rural parents asking about having your child routinely tested to go back to school. So you would think all kinds of red flags would be going up. Every single message we tested, they all gave all of them a 10 out of 10. And this is our favorite quote ever. If I had those rapid tests at home, I would be popping them like candy. People want their kids safe. They wanted their kids back in school, and they were willing to do anything to make that happen. So that gave us great confidence in being able to go out and reinforce with people that they were doing the right thing. We could promote a social norm and remind people and reinforce that they were doing great stuff, that there were reasons to keep doing it, and they needed to keep doing it right now. And so that was, I think, that the second thing. So first, know your audience. Second, give people frameworks. Think in flexible frameworks rather than dictates or even tools. Like we tried actually creating materials. Nobody wanted those. They wanted guidance that would help them respond because they were all wrestling. As Estelle said, this thing changed every day. So to give you a fact sheet on something that would be out of date by the end of the week wasn't useful to anybody. But giving these big ideas that they could then hang their messaging on was really, really useful. So we created this framework around testing of do your part, do it for them before it's too late, with detail on why. So all of this is wrapped up in the message, contact tracing and message testing toolkit. We have the link later on in the deck so everyone can go see it. But they're based on these big ideas of social proof, wanting to be some part of something bigger than yourself. You know, Hattaway's calling card is our aspirational messaging. We all want to see ourselves as people who put our own interests aside for the greater good, and that resonated with people. And then finally, before it's too late, you know, do it now, keep doing it. It's okay to take this seriously because it is serious. So go to the next slide. Really importantly, most people agreed when we said we gave them very specific messaging, which is outlined here, and 70+% of people said, yes, this is convincing to me. If I heard this, I would do this. So again, this is what we thought, this is what we developed, and it worked. And we could give that data to those public health people and especially the scientists that Estelle mentioned to say, we don't need to get into the weeds about a PCR test versus an antigen test and the relative this and the relative that. You can just say, do your part, and millions of people are doing this, and many people will do it when they're asked. So to keep going, we also wanted to make this really useful for people by giving them these tips of how to make what they already had work better. So all of these examples and these sort of say this, not that, were pulled from things that we saw in our partners. So people were always saying, you know, this is something that we saw on the website of one of the partners. If you don't participate, you're putting lives at risk. We know what you're trying to say. Why don't you say, think of your closest family and friends, they take action. If Carlos, you can go to the next one. You know, evoke, a lot of the imagery was, you know, people protesting or really sick people. Neither of those are appealing to the vast majority of us. So show them people like them doing the right thing, reminding them that they're doing this to protect their family and friends, not a directive to say, go make an appointment. So the tone, the content, the image all work together. And I will very quickly take you through a similar framework on vaccines, because I know that is very top of mind for many people right now. And vaccines were interesting. People at this point, right, we did this work in February, had nearly a year of kind of being on their own. You know, they were bootstrapping protective strategies together for themselves, their family, if they had to go to work, what to do at work, how to keep things going. So, and the messaging kept changing. So people were highly skeptical that suddenly there was a magic bullet that was going to end all this, because they'd heard it before. And also they had been doing their own thing for a long time, and it was working pretty well for most of them. Most of us have not been infected. So to say to someone, stop doing what you're doing, just get this vaccine, all's going to be good, was not credible. But as we saw with the testing, social proof, really important for people. When you see other people getting it, you see that you could get it too. And we've seen that play out since January. You know, that was a lot of people's barriers. I want to see more people get it before I do it. Now that people have seen it and seen fewer, you know, most people doing pretty well with it. Lots of people, that was the lever that took them from, I'll get it someday to I'll get it now. And the rapid development is the 900-pound gorilla. People think it was created too fast. The name that was created by the previous administration did not help. Operation Warp Speed does not reinforce confidence in anybody about the vaccines. But again, what we did, and you can skip the next slide, Carlos, and go to the one after that, was create this sort of umbrella framing that people could use around vaccines that took this into account. So instead of saying, go get a vaccine, it's one more tool you can use. So giving people their own self-efficacy, showing that it was a continuum of the other things that had been working for them, and giving them that sense of control. Literally, you will have the upper hand. And also sort of balancing our promise of benefit, which, especially as Delta variant has risen, this message was right and still is right. Even if you're exposed, you will be okay. That is the message that everyone's valiantly trying to say now when people are saying, look, I had the vaccine, but I got infected. Yes, but even though you're exposed, you are doing okay. And that is an umbrella framing that worked then, still works, and really responds to the needs of the audience. And if you can keep going, we created another flexible framework for people, again, about guidelines for how to talk to people, help them across the finish line. Most people were not and are not hard no's. There are hard no's, but most people are not yets. So how do you help them get closer to that finish line and get it sooner than they would have without talking to you? Again, don't make it an ultimatum. People are very resistant to that. Show it as part of a tool that you can add to your arsenal to help protect yourself and your family. And that this refrain from insistent, demanding, or overly urgent language, people really recoil from that. Don't tell me what to do and when to do it. I'm going to decide. So again, help them across the finish line and encourage them to keep looking, keep listening, and keep finding out what they need to get it done for themselves. And then really emphasize the benefits, right? We're all public health people are always solving problems. And the problem is some people have side effects. So everybody leads with the side effects. Emphasize the benefits. Unfortunately, some of those benefits have been scaled back, but the benefit of seeing your friends and family for the first time is incredibly powerful for people. The benefit of being able to socialize without masks, to be able to go visit family you haven't seen, hugely, hugely important to people, and just keep reminding people of those was the way to get them to get this done. And then two last things, which we call fun facts. This is an example of us filling a gap that nobody else had filled, but also that was of deep concern to our clients. So the public health people are all burned out about getting tested. They all get tested all the time, and they were seeing the testing numbers decline. And so they were worried about it, and they were worried that there was testing fatigue. Nobody that we could find had ever asked how many Americans have been tested how often. So we did. And it turned out most of us had never, very rarely been tested. So again, we were able to say there is not testing fatigue. You should feel confident continuing to remind people that testing is available and there are times when you need it without worry that people are burned out and don't want it. And the last thing, very big in the news, was about incentives. A lot of talk about $1 million lotteries, free donuts. What would actually get people to do any of these things? We'll show one slide, which was for testing. The line for vaccines was basically the same. And if you want your faith in humanity restored, it's that the top answer by far for both was, I do not need incentives for this. But that said, if you're going to offer me something, cash is always acceptable. And some of the more kind of gadgety ones, like the donuts or the celebrities, most people, that's not going to motivate them. But what it does, it gives you a news hook. So it's a way to get back into the news, the idea that testing still matters, people should still do it, there's a reason to do it, and it's a way to reframe and put the attention back on testing when it's dropped in a community.
So Krispy Kreme won the messaging wars on some level.
Exactly. And I don't want to overpromise, because 4 out of 10 people, some kind of incentive might be appealing. So it's not that it wasn't important, but far more important was most people were understanding and doing it for all kinds of good reasons.
All right, and gang, we have a little time to do Q&A here, I think, but there's no questions. So Kara, quick question for you would be, obviously this was a dynamic environment, remains a dynamic environment. What surprised you between the time you started in August and let's say maybe the last time you guys were out in the field in May? What shifted or what started to bubble up that was just surprised you or confounded your expectations?
Yeah, the interesting thing was how little changed. Most people were still taking this pretty seriously. So you saw that first slide, which had all 4 waves. Mm-hmm. Things dropped a little bit, but they dropped about 10%. Even between February and May, when vaccines were widely available, most people were still willing to wear a mask, get a test, stay socially distanced if it were recommended to them. And I think that, again, is sort of heartening and not what you hear a whole lot from people about these things.
Maybe I'll take the privilege of the second question, which is, that's so at odds with what most of us were seeing. If you just checked in on Facebook or Twitter, social media, or picked up even a reputable newspaper, a lot of alarm, a lot of concern that there was politics playing a huge outsized role in how people were thinking about this. But you're saying that's not actually what you saw. when you talk to actual people.
Now, and to tease the RAND survey again, I saw a story on the news last night that said, the mask wars in schools. There is no mask war in schools. There's a political shouting match going on about masks in schools, but the vast majority of parents want their kids in schools, and they are totally okay having their kids wear masks in schools. And so, again, that's a misleading headline. There's no war going on among the people who actually matter, which are parents and kids.
So we are seeing sort of parallel tracks. One is loud and noisy and grabbing eyeballs, and then there's those of us who are just sort of living our daily lives, we're trying to find our way through this.
Everybody safely and happily going back to school is like the dog that does not bark in the night. It's not a news story.
Gotcha. All right, Carlos, you want to join us? Are you done, or
Yeah.
do I have that right? Okay, Carlos, your turn, sir.
All right, thanks. As we mentioned in the beginning of the webinar, we've also along created with everything else that Rockefeller Foundation does and with their staff community, have created this communications community of practice. So I want to just share some lessons that we've gathered on how to build and sustain a community of practice, as well as just share some key lessons from our amazing lineup of panelists. If you've attended one of our sessions, we have a wide variety of topics we've covered. We started formally these webinars, probably I think around January. We had over a dozen, and we grew. In the first webinar, we had around 50, 60 signups. We now have had over 600 unique signups to date. So we have that 600 unique user distribution lists. We have about 50 to 100 per webinar. So we just want to share how have we built and sustained this community of practice, just by sharing a few lessons. Number one, it's not all about data. So yes, research, it's sort of like an antithesis of what we've just been presented, because we just showed a lot of research, which is amazing, and people find it very useful to inform their communication strategies, and our participants look for that. But we've also had very, very successful webinars where there was no data being shared, and it was all about personal and professional experiences on how cities and professional health and other communications folks have managed to find their way through this pandemic. Most recently, I remember we just had representatives from the city of Falls Church, including the vice mayor and directors from their public schools, to talk about their experiences of working together with different city departments and schools, and the challenges of keeping a united front with parents, and how they communicate with parents and students throughout the pandemic. Number two is to make it relevant. As I said, we've had a wide variety of topics that we cover in our webinars, from misinformation experts to social science researchers, talking about how to communicate with Latinx audiences, to former Congress people on how to engage conservative audiences. And this is because we've been paying attention to what's concerning our audiences and our distribution list, taking a look at the questions and the comments you're sharing, as well as having post-webinar surveys where we can learn more about the topics that they want to be hearing from. And most importantly, is to listen and keep the pulse of what's going on in the news and recognize what's going to be most of interest, and not always just painting a rosy picture of how communications is so awesome all the time. We've heard a lot from folks, especially I think it was around February, March, where there's a real burnout in teams, especially around folks that were handling social media for public health departments, of just getting barraged with a lot of hate comments and taking a toll on them. So just being able to acknowledge those very hard emotional challenges folks were facing, and they're coming back now that some universities and schools and others are dealing now with the Delta variant and having to change up strategies in a way that they didn't think they would have to acknowledge that emotional challenges that folks are facing on the communications front. And most importantly, it's to spread the knowledge. We encourage every single one of our presenters to have clear takeaways. We know we're all overloaded with Zoom calls and conferences, so we want to make it as easy for folks to remember helpful tips, tools, and information, such as those frameworks that Carrie just shared on. Do it for them, do your part, and before it's too late, just if you can take anything away from our webinar, sometimes it's just those three little things folks will always remember. So we always encourage our panelists to do that. And right now, I'm also going to show you a few lessons that our amazing panelists have shared. We've had over a dozen webinars, over probably 40 different panelists all throughout. So I'm just going to share three ones that we keep thinking and coming back to over and over as we continue doing this work. Number one is to don't shy away from humor, trust your audience. We recently hosted Kevin Parent, a brilliant, funny guy that works at Ottawa Public Health in Canada, who started getting a lot of notoriety because of their use of humor on the Twitter account of Ottawa Public Health. One of the tweets that they wrote was like, the idea that COVID-19 is a global conspiracy involving every nurse, doctor, hospital, health unit, and government on Earth shows a rather optimistic view of project management. Misinformation is out there, check out the truth here. They also had a long-standing running joke in the Twitter account of putting intentionally messed up tweets about the wrong image in the tweet, and they would blame it on Bruce the intern. That's what they call them. And then they actually got Ryan Reynolds, who's Canadian, who out of his own volition offered to make a video of presenting himself as Bruce the intern to the audience, which was a very natural engagement. It wasn't about celebrity influencers. He did it on his own, wrote, directed, and shot the video on his own. So that was one of the key lessons. Kevin really knew his audience, knew where the line between humor and seriousness is, and knows how to play it, and knows how to use humor as a very effective tool of engagement. Which impressed a lot of our public health folks that attended our webinars, who normally have very strict guidelines of what they can and can't share. And we're just amazed about hearing this guy of like, where you run a public health account department and you can make jokes. Like just by that, it was like mind blowing. So just sharing a little bit about like what's out there and opening folks' minds was a really great one. Number two is to earn your community's trust by leading with compassion and love. Again, we heard from the folks of the City of Falls Church when the pandemic first started, they carried a very simple, straightforward, emotional message. We miss you and we can't wait to have you back. You know, they framed every action. They said, you know, from a core message of love to build trust. And this openness to showing their emotion and their trust from their community all throughout the different stages of the pandemic, from routine testing to vaccination. They had extremely high participation rates from school and government employees. When the vaccinations hits, they had over 97% of their school employees already vaccinated because they built trust and compassion along the way in many various forms, but just building out their whole strategy around compassion and love, which can sound very simple, but it's a very disarming and like emotional message that sometimes we don't always remember to consider when we're doing this. And number three was to finally validate emotions and don't dismiss concerns. You know, as frustrating as it may be for us to hear in research and in all these presentations, some of the reasons why folks aren't sure about being vaccinated yet, what we've learned is that, you know, some of these are serious concerns for them and should be treated as such. You know, we've heard from our misinformation experts, as well as other public health professionals, to not dismiss their emotions or concerns, rather share what you know and what you don't know. Don't repeat misinformation or try to over-explain or go down the rabbit hole with them. Just simply present what it is that you know, what it is that we don't know, the benefits, and always express empathy, as folks have some serious health concerns around some of these issues.
Thank you, sir. And gang, I think now we have time for a few questions. We've got about 5 minutes left. So if you'd like, if you would, once again, just go ahead and put your questions into that Q&A box. And Carlos, I guess a question as we're waiting for folks to maybe jump in there for you would be, as you were building this a community of practice, what was the disposition of folks entering? I mean, they're all in the middle of a very, very complicated situation. They're really busy, but they're making time to do this.
Yeah.
How did that community evolve? And what's the journey that they've been on over the last few months?
I will say at the beginning, it was a little bit challenging for us to, like you said, you know, in January, February, March, folks were extremely busy. So to give up an hour of their time a week to come and be also prep for a presentation and share the information, we had to sort of like convince them and see the benefit of opening this up to others. And once the community started engaging through the comments, sharing their emails, connecting outside of the webinars, it really started clicking for folks. And as we build the audience, we now have our next 4 ones already set because we've had so much interest from others of like, we need to get this out there as fast as we can because folks need to hear what's happening in others' spaces.
Question I saw earlier from someone, and I'll bring it back here, was a concern that there was a disconnect between folks doing the science, maybe as Carrie spoke to this, about PCR tests versus, and gang, I'm about to prove my ignorance here. I don't know what happens after PCR tests. I know there are various tests out there, but people who wanted to really dig down into the weeds and show detail versus the research that was telling you or revealing folks didn't need all that data. In fact, it was probably slowing them down and in some cases, maybe even doing a little bit of harm. How did you all start to get buy-in? And Estelle or Carrie, if you want to jump in here, be my guest. How'd you get buy-in from the folks in the technical space who obviously have a great deal of fidelity to process and to accuracy and to detail?
That's another place where the frameworks are really helpful, because we could not say don't talk about it. If you're an epidemiologist, of course you're going to get into the details and the science in some ways, but to start with that framing message, that unified message about the topic, so that always got carried through. So that was where it was useful, is we made it easy for them as well to use these tools, but didn't dictate what they had to say to them, say exactly. But then it would increase the likelihood that people would see even the technical information in a different light.
And I guess I could build on that, if that's okay. We have some time.
Yes, please.
So it's so important to have this research because you can point to real data, both the quant data and the qualitative data from the focus groups. But then also you're hearing, you will hear anecdotal experiences from our grantees who are like, people are confused. So when you're hearing things internally that are also corroborated by what the program team is hearing externally, then it clicks for people.
One of the other things I think that's sort of implicit in all that y'all have said is this idea of time and repetition. So we've all been in this really difficult circumstance for well over a year now. I don't know about y'all, but I'm exhausted by this. And so I certainly can profess some fatigue. But it seems like what's really clear and necessary is that, for instance, some of the folks you guys were talking to about testing were convinced everybody had heard everything about testing and didn't need to talk about it anymore. But your data, actually, your research showed just the opposite, that plenty of people still needed to be talked to, hadn't heard those messages. How do you reconcile folks who are working on this every day, 24 hours a day, nonstop for over a year, with folks who are doing their very best to stay informed, but have other things calling for their attention? How do you reconcile those two things, telling people you need to keep at this repetition piece?
I mean, I do think that's the benefit of this effort by Rockefeller to bring in just a broad public health, but also attuned to the public attitude. And how do we solve this? What do people really need to know? Because public health people also are dealing with everything else that was also going on. There were still water main breaks and all the other things that they have to message about. So the more you could, again, the data was really critical because everyone was skeptical. I mean, people said, I was walking down the street, 70% of people are not wearing masks. But when you could link it to a message and saw the message was compelling, then they were like, well, okay, this is a tool I can use. So I think that was a big part of it. And having these regular check-ins of asking the same set of tracking questions for now over a year, but also sort of addressing the issues of the day as well. So we could say, here's the result of the tracking question. Here's the new set we added, just looking at like the incentives question was new. And we could then cut and look at who actually, was there anyone for whom an incentive actually really would be great if we were looking at whether it was deeply resistant people or people at high risk or things like that. So it gave us a baseline to be pretty confident in, and then really tailor the information based on new stuff that we saw emerging. I know you're muted, Sean.
Muted myself. Sorry about that, gang. A final question before we let everybody go, and that would be, what's the one thing that's missing right now as we move into this new time of Delta? And obviously we've seen some really serious outbreaks up in Provincetown. I know some other places in New England, really across the country. We've seen spikes everywhere. What's the one thing you wish people would take away from this conversation as we move into this next or new phase of the pandemic?
This is a hard one. I think for me, it goes back to the question that you asked, the last question about the repetition. Even though it's been over a year, even though, the Delta variant means that this pandemic is evolving yet again, and we know it's going to evolve and constantly evolve. When you use messages that are effective and tested, and you constantly repeat it, we know from marketing and from the marketing world that you need to hear something at least 7 times before it sticks. So just constantly repeating and using the right types of messages that get people to take an action, we just have to keep doing it, and we have to hammer home the point. And just like people sometimes are like, masks, just, it's annoying. I'm going to wear it. I'm going to continue wearing it. Like, it's still the test thing that works. So that's what I would say.
Carrie, Carlos, any thoughts on that, or just a parting thought to share?
Well, yeah, I think this idea of self-efficacy is really important. You know, we're all in this together, and yet we have to act independently. And so the idea that the action is not about me. You know, I'm vaccinated. I wear a mask everywhere now because it's the law. I'm in DC right now, but also because there are people who that protects. And as annoying as it is on a day that apparently the heat index here in DC is 106, you know, it's annoying for me to do that today. And really, I am not at risk right now, but other people are. And I think it's that sense of you can do it, and there is a greater outcome. There's an aspiration that we all are trying to get to, which is to get to the end of this thing. And that little action will help us get there.
Carlos, how about you, sir?
I think sort of tied to what Estelle was sharing, let's not forget what we've learned. You know, thinking back a year ago from now when we embarked on a lot of this research, we now know a whole lot more on what works communications-wise on talking about these topics with folks. We don't need to abandon those lessons, even as the things are still shifting and changing. A lot of the same things still hold true. So we don't need to be reinventing the wheel. We know a little bit now like what things work, so let's keep building on those.
Gotcha. And with that, we are a little past time. Thanks everybody for being with us. My huge gratitude to Estelle, Carrie, and Carlos, of course, Kenya, for being with us and offering her ASL services, interpretation services. Hope everybody stays safe and well. We've got some resources we put in the chat, and this webinar has been recorded. We'll host it up on YouTube probably within the next couple hours, gang, but certainly by sometime tomorrow. And you can look for it on comnetwork.org. We'll have a link for it there. In the meantime, please be safe and well, and we'll be back in touch with something else coming up before too long. And we'll talk to you all soon. Be well, everybody. Thank you.
Thank you.
Thank you.